Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Do you have headaches, depression, type 2 diabetes? These are three of the top 5 common ailments reported by millennials, folks born between 1981 and 1996. How do you treat these conditions? Joining us is Dr. Saima Lodhi. She's an internal medicine specialist with the Scripps Coastal Medical Group in San Diego, California. Doctor, thanks so much for being with us.
Thank you for having me.
So this recent study says 44% of millennials have a chronic health condition. What is triggering this?
So, a chronic health condition is a condition or a set of symptoms that last for more than several months at a time. And it can be a set of symptoms that people experience every day or that come and go, but is defined as something that they have to learn to manage. And many of those are the ones that you referred to earlier, such as headaches, depression, or type 2 diabetes.
And the other two are asthma and hypertension. So let's just go through these conditions and tell us what causes them. Let's go through it. Headaches.
Headaches are very, very common. The most common cause of headaches is actually migraines, which is a very specific type of headache. Headaches can also be due to sinus pain and pressure, which can be triggered by changes in the atmosphere and weather. We've had plenty of that recently. Headaches can be due to hormonal changes. Also, stress can cause headaches. So there are many different causes of different types of headaches that we see.
And what about depression?
Depression and headaches can actually be both common conditions found in the same person. Depression is much more commonly identified now amongst millennials as they have so many more factors that feed into causes for depression, so many more different types of stressors that they have to manage and navigate. And also, Susan, we're now really trying to destigmatize acknowledging the presence of depression in our community and really making it okay to talk about. So it's reported much more now, even though it may have been present just as much in older generations.
And what about asthma?
Asthma is a condition that may be genetic. It may be worsened by environmental factors. Again, like we talked about with environmental factors being so much in flux right now. Allergies and asthma go hand in hand. Smoking and vaping can trigger asthma, and we've seen some fluctuating trends in that among millennials as well.
And what about type 2 diabetes?
We are unfortunately seeing some persistence of type 2 diabetes, which goes hand in hand with obesity. Obesity is still a significant problem among millennials in our culture. Type 2 diabetes is also very much related to genetics. If you have a family history of diabetes, then that may predispose you to that very common condition. And we are diagnosing diabetes all the time, even in younger people.
And what about hypertension? What is that?
Hypertension is elevated blood pressure, which occurs in the major blood vessels of our body that can cause strokes, heart attacks, or damage to vital organs in our bodies.
So how do you treat these chronic conditions?
First of all, it's very important to have a good relationship with a primary care physician. Chronic conditions, by definition, are not a one-time in and one-time out in an urgent care or a health express clinic. They need to be managed by somebody that you know and trust on a regular basis. So that is the first thing I would say. The second thing is to be aware and to educate yourself about your own chronic condition so you can take steps to manage it based on what your doctor tells you you need to do.
Can you prevent these chronic conditions? I think, for example, type 2 diabetes, if you lose weight, then that would prevent type 2 diabetes.
Absolutely, Susan. There are many lifestyle measures that we can do to help ourselves from acquiring many chronic conditions. And type 2 diabetes is a perfect example. High blood pressure is another one. So maintaining a healthy body weight, eating a diet that is low in saturated fat, low in sodium or salt, eating a diet that is high in fiber, exercising regularly can help prevent actually both of those two very common chronic conditions.
And what about preventing headaches and depression and asthma?
Those are a little bit different in terms of what we can do to prevent them. I think awareness, recognizing symptoms, if one has shortness of breath with asthma, for example, also being willing to talk about things like depression or common headaches, and just being aware of what your body is trying to tell you and having that conversation with your primary care physician. Getting regular sleep and exercise is helpful to help manage headaches. Also depression, And there are so many lifestyle factors that go into managing all of these, and some of them overlap, such as healthy eating, exercise, proper sleep, and avoiding smoking and vaping, for example.
So when should you go see your doctor? And should you go see your primary care doctor versus a specialist?
I would always recommend starting with a primary care physician. Your primary care physician is going to be your friend for a long time and is going to help guide you in terms of when you should see a specialist. And in this day and age, when information is so easily accessible, we sometimes fall victim to information overload and we think we may know what specialist we need to see. And I would say let your primary care physician do that work for you so they can guide you to the specialist if needed. And there is a lot primary care physicians can manage in their office without referring you to a specialist, particularly for those chronic conditions.
Millennials are very tech savvy, and in a lot of cases, you can treat these conditions without actually going into the doctor's office. Talk a little bit about video visits at Scripps and how you can also schedule those visits online.
Yes, video visits are huge and they're very useful for certain chronic conditions. And this is the way the world has gone, especially with the onset of COVID pandemic, where a lot of people began using video visits to access healthcare in a safe way. And what we've realized is that is a silver lining that's here to stay as an option to manage several conditions, such as frequent visits to assess progress of depression, for example, or to review your headache diary to see if your headaches are getting better or worse. And those video visits are very easy to schedule through Scripps. We have several different options with not just primary care, but also specialty care for video visit management, if that is indicated.
And in order to schedule those online video visits, all you need to do is sign up for an account. You go to myscripps.org and then put in the scheduling. It's real easy.
It's very simple. All you need is a device, and we all have one of those, especially millennials.
Once you get a handle on these conditions, what are the benefits?
The benefits include, they're multifold. It includes awareness of what the triggers are, for example, migraines, which may have many different triggers, and they can vary for different people. Migraines are a form of headaches. Also, depression or asthma. It's helpful to understand what are the triggers that you can manage or avoid, when to use certain medications, when do you need a medication to treat an acute migraine versus a daily medicine to help prevent migraines. So these are all discussions to have in sync with your primary care physician to come up with a customized plan to manage your own health. It can vary from person to person, even for the same diagnosis.
And then the other benefits would be lower cost, longer life, and a higher quality of life, I assume.
Absolutely. So managing these conditions and finding ways to help prevent them if you have genetic risk for them will, of course, lead to better health outcomes, fewer reasons or fewer risks to go into the hospital, better health, and less risk for severe disease or death. Absolutely.
If you don't get a handle on these conditions, doctor, what can happen in the long term?
Long term, every single one of these conditions can have severe consequences, and there may be hospitalizations that can happen. There can be fatal outcomes with consequences of some of these conditions. So the consequences are actually quite huge, and all of that can be prevented with managing appropriately with your regular doctor.
And it would be a much higher financial cost, right? And also a lot added stress if you don't get a handle on these, and a shorter lifespan, really, too.
Absolutely. And one other thing, many of these health conditions are interrelated, depression and headaches, for example, and getting a handle on one of them may help manage one of the other conditions. Diabetes and hypertension are also closely related. So sometimes managing one means managing both. So we're doing a lot when we go visit our doctor and talk about all of these chronic conditions.
Any final thoughts, doctor?
Yes, if you have or if you suspect that you may have chronic headaches, depression, asthma, type 2 diabetes, or high blood pressure, then it's important to establish a relationship with a primary care physician. You should not wait. You should not think that they will just go away on their own or resolve themselves, or that you can manage it all on your own with doing your own Google search or WebMD search. It's tempting, but let us help you. And please go and find a primary care physician and establish that relationship so you can take control of your health.
And once you establish that relationship with that in-person visit, then you can do the video visits, kind of like we're doing right now with this video.
Absolutely.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you for having me, Susan.
If you want more information on how to treat these common ailments that are facing millennials, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.